Oh, thanks, Victoria. Thanks, everybody, for being on today. Actually, I'm just going to back it up for one little moment and just talk about the sequencing, because now we have the benefit of hindsight. We look like there was a switch that was flicked. And one day we knew what we were doing with our programs in the way that we'd already done them, and then we all went to online provision. In fact, if you remember, this unfolded over a period of weeks of uncertainty. Are we closed? Are we open? Are we flying? Are we not? Are we this? And this uncertainty actually was very disruptive for organizations. And at the heart of our conversation today is not the outcome of our Holocaust education and memorial programming. We'll get to that. We've adjusted. It's actually what happens when people are doing something together and have a mission to fulfill, and that mission is disrupted. How do those people work together, continue to live together, to continue to achieve things together in a way that actually is unity? And for me, the first thing wasn't how do I now say, okay, I've got digital tools, how do I maximize those? It's how do I look after my community? What do I do about the Holocaust survivors who are part of our community? How do we work together to ensure the integrity of our organization, not necessarily the outcome of our work? I think it's really important in this, because it's got to be, everything has to be people-centered in our lives, because our mission is all about people. That said, the Shoah Foundation at USC, as you know, is highly digital. We have many digital tools, so it wasn't that difficult for us to, we're all using the word pivot, but to pivot. And I'll just share a couple of things with you from our website. For example, Eyewitness, which is our education website, you can see here, we moved to having a whole section on how to teach from home, something that's not working. But when I go here, I get to find out the provision of working from home. The same was true of the Shoah Foundation's website, by which once you're in the website, we created a section called What is Home, at the point at which we realized we're all going to be at home, and focused our attention on supporting our users and our classes and our stakeholders by looking at testimony that talks about home, that talks about family values, that talks about what it means in a time when we're actually stuck at home, to really start to appreciate the values of home, and use testimony to do that. I have so much to share, but I want to make sure gets to respond to.
Thanks, Stephen. And I think that's a really important issue you raised there at the beginning, that this was this huge sense of uncertainty, and we never really knew what was going to happen. And I think that was shared across many countries. Heather, could you share your experience now?
Okay, so I think our experience in South Africa was a very different kind of experience, because we were way behind of what was happening in Europe and in the States. And I think naively we had this idea that because we lived in Africa where it's sunny and it's warm, that we won't really be affected by COVID. However, when they decided to do the lockdown, we were literally given a week's notice. That within a week, you will be in lockdown, 21 days, you will not be able to go to the office, you cannot leave your home. There were very rigid restrictions. And I think that we as a centre had felt that probably it would be 21 days, which is what it was supposed to be, and then we'd all go back to work. Very naive. 9 weeks later, we're still sitting in lockdown. So were we in a position to go online? Absolutely not. We have a centre that was extremely busy, and we were continuously doing things within the bricks and mortar space, within actual documents and resources, that we hadn't really focused on what do we do online. So all of the tools that we had, whether it was a website, it was a static website that provided information. Whether we were using social media tools, it was really about how do we use those tools to advertise what we were doing, or for commemorations, or for the blogs. The only area of our centre that was really online ready was our archive. And this is an archive that had been built up over a period of time, a number of years, in collaboration with the University of Cape Town. And there it was, and has always been, a resource for an online resource for academics, researchers, etc. So when we ended up in this lockdown period, it was really having to very quickly think about who are we, what do we do, how do we continue what our mission is, where should we be responsible to. And I think in the beginning it was very much trying a little bit here and a little bit there to see what was working with webinars, etc. But we soon realized that our function is really with education, the education of school children, of learners, and how do we assist the education departments with a massive job of educating people who have very little and not access to technology, and how do we get around that? So for us, it's a learning process. I think we've done unbelievably well so far, but we still have a lot to learn. And also it's about collaborations with other centers around the world, not having to reinvent technology, but to rather see how do we partner with other centers in being able to share what we all primarily are wanting to do, and that is to keep the Holocaust alive and protect human rights and genocides, etc., etc.
Thank you, Heather. And we were talking just before this event about how the Centre in Cape Town has been really good at thinking about the way different people access different platforms. And I was really honoured to do a public lecture for you a few weeks ago, and it was brilliant to see that Zoom was being used with a small local audience, but put out broadcast on Facebook and then put on YouTube later and advertised on Twitter. So that really, I think, shows that kind of network thinking, and we're thinking about those different audiences that you were mentioning and who can you access with the technology. Could we go to Anna next?
Hi, so at the end of February, when we started hearing about the virus and the panic started increasing and the worries, and it started looking as though things were going to take hold, our first concern were, of course, our survivors who are in their late 80s and going up to their late 90s. So they were the first to be asked not to come into the centre. And, you know, they're so precious to us. We need to make sure that everyone is as healthy as can be. The strange thing about this whole situation is that we have been working towards a new building project for some time now. And we were scheduled to move out of our current building in mid-April. So we were going to be relocating to another site, and the current building where the Holocaust Centre is and the museum is scheduled to be completely demolished for a 4-storey new building, so a major building project. So we'd been working very hard for some time, and we had all these contingencies and thinking of worst case scenarios, but an epidemic was not on our radar, of course. So as it became more apparent that we would have to delay, and I think that started with the realisation of how serious it was getting overseas. The country, Australia, shut their borders at a really good time, so we were very fortunate. We've got really fantastic resources. We have our own testimonies department, and with video testimonies, AV, and most of the archival collection has been digitised. Our website had been revamped about a year ago, so it's much more clear and easy to access. There's a collections online, which also includes the video testimonies where people from around the world can do searches. There's an online exhibition of the Lodge Ghetto, for example. Education have a fantastic presence with things like story pods with short versions of survivor testimony. So we were actually in a pretty good position to continue that digital presence, and so I think that we started off pretty well, but obviously it was such a shock, and you know, to reduce the, firstly it was this gradual reduction of who could come in, and then we were saying, not this week, it'll just be for a couple of weeks, but our priority is the health and the safety of everyone.
Thanks, Anna. And then finally, if we could come on to Marc.
Hi, everybody. We've obviously experienced all the elements that you have all described. I'd say that I felt bipolar when we realised we had to lock down, because on the one hand, we're very digital content rich, and had lots and lots of stuff to show, and digital outreach was already a part of our business plan. So we're really doubling down on that. The absolute gobsmacking worry, though, is what you've all mentioned too, which is keeping in touch with the people that we love the most, the survivors. Some, as it happens, are very technologically literate and savvy, and had one or two of them immediately jumping onto Zoom and trying to work out how they put their digital backgrounds in and buying green screens, and it was heartwarming. Actually, it was wonderful. So we have had some lovely Facebook Live and Twitter Periscope sessions and Zoom sessions with engaging quite substantial sections of the public, where the survivors are able to be comfortable in that medium. It's like going from a very serious kind of field of testimony and analysis and discussion, etc., to memory, to being in live event broadcasting, with showers and showers of comments from Facebook people, some of which are highly superficial. I have to say we haven't had any deniers or any aggressive stuff, which is nice. I don't tend to fake too much, but it's a very different environment to be for a survivor to be giving their testimony in a potted version, where the whole point of the format is to make people in lockdown out there, especially younger people, feel included in something, feel part of a community, and therefore it becomes as much about them as about the survivor, which I think we all struggle with a bit, because actually it's about these unique and special people. So they've gone along with it, those that are comfortable with the medium. I think they're more comfortable with it now than perhaps I and my team are, because the last thing you want to do is denigrate them with superficiality. In terms of everything else, though, a digital transformation, networking with our colleagues, as I say, we're all doing it anyway. We've got like, we have our version of the interactive testing. We have the Forever Project. We have an app launching on the App Store, which is the basis of our Journey exhibition, which is aimed at primary school kids, and that's a highly interactive 60 to 90 minute experience. Puts you effectively in the shoes of a 10-year-old Jewish boy living in Berlin in the 1930s before escaping on the Kindertransport. We have any number of downloadable video exercises from the website, and as I say, an ongoing program of live events. For me, the sweet spot is where you have the survivor who's comfortable, and whose testimony and whole being isn't denigrated by being in a Facebooky kind of place, but where you are making what we're saying relevant, not just today, but right now, this hour. So Corona racism, we're really trying to think hard about how the particular survivors and particular testimonies are relatable, because unfortunately 75 years later, you can't assume that your young audience give a damn or even know what you're talking about. So if you can kind of contrast LGBT hate then in Sachsenhausen with the pink triangle to this very famous example in England, a lesbian couple being beaten up on the bus, you're maximizing your chances of building that community online, because you're finding shared interests immediately. So that's what we're about at the moment.